Did you know that 1 in 8 men will face prostate cancer at some point in his life? Stay with me because today I will reveal the 8 most silent signs you should never ignore. Prostate cancer is the second most lethal cancer among men and often advances silently. Early detection is critical for effective treatment. Let's find out together how to protect yourself. One of the first signs of prostate cancer is the increase in urinary frequency, known as pollachiuria. Usually a healthy person urines between 6 and 8 times a day and at most at night. However, when the prostate begins to increase, whether for benign or malignant reasons, many men notice a significant increase in urinary frequency, especially at night. This is called nicturia. Moreover, another common sign is the urinary urgency, which refers to the sudden and uncontrollable need to go to the bathroom. This urgency can be uncomfortable and even interfere with the daily activities of individuals. Often there is also a persistent feeling that the bladder was not completely emptied after urinating. These initial signs may go unnoticed or attributed to other less serious health problems, but they are important alerts that should not be ignored. In addition to the sudden urinary urgency and the sensation of bladder not completely empty, another important sign to observe is hesitation during urination. Many men may notice a difficulty in starting the act of urinating, which may be an early indicative of prostate changes. This hesitation may be subtle at first, but become more evident over time and may cause discomfort and anxiety. The difficulty in completely emptying the bladder is also a common symptom of prostate cancer in early stages. Even after urinating, the feeling that there is still urine in the bladder may persist. These signs should not be disregarded and require medical attention to proper assessment. In addition to the symptoms mentioned earlier, another sign to be carefully observed is the change in the urine jet. Men who are developing prostate cancer may notice changes in force and urinary flow pattern. The jet can become weaker, intermittent, or difficult to maintain continuity of the flow. These changes may be subtle at first, but as the condition gets worse, they become more evident and uncomfortable during the act of urinar. Observing urine jet behavior is crucial to identifying possible prostate problems and seeking specialized medical advice. In addition to the symptoms mentioned earlier, urinary incontinence is a sign that deserves special attention when it comes to prostate cancer. Loss of bladder control may be a more advanced symptom of the disease and can manifest as involuntary urine escapes. This not only affects physical health, but also has a significant impact on quality of life and self-esteem. Many men may feel ashamed or embarrassed due to urinary incontinence, which leads them to postpone the search for medical help. However, it is essential to understand that urinary incontinence can be an important indicative of prostate problems and should be discussed with a healthcare professional without delay for evaluation and possible treatments. Painting pain in persistent lower back is a symptom that deserves special attention when it comes to prostate cancer. This pain may be a sign that cancer is already in advanced stages and possibly spread to bones, especially to the spine. Pain in the lumbar region caused by prostate cancer tends to be deep, intense, and constant, often not relieving rest or common medicines. In some cases, this pain may get worse at night or lying down, interfering with sleep and significantly affecting the individual's quality of life. It is essential to emphasize that this pain should not be confused with normal muscle discomfort or age-related wear. If you are facing persistent pain in the lower back, especially if it is associated with other symptoms mentioned above, it is crucial to seek immediate medical evaluation for investigation and accurate diagnosis. The presence of blood in the urine, known as hematuria or semen, called hemospermia, are symptoms that often cause anguish and concern. Although they may have benign causes, such as urinary infections or prostate inflammation, it is crucial not to underestimate the potential meaning of these signs. Both hematuria and hemospermia can point to more serious problems, including urinary tract cancer or prostate itself. In addition, urine color is also an important factor to observe. Reddish pink or brown shades should not be ignored, and always require medical evaluation. Early detection of any blood presence in the urine or semen is critical to discarding possible serious conditions and starting proper treatment as soon as possible. In addition to noticeable physical symptoms such as increased urinary frequency and incontinence, prostate cancer can also cause significant metabolic changes in the body. Inexplicable weight loss and constant sensation of tiredness are signs that the body is fighting the disease. This struggle consumes a lot of energy, while cancer cells feed on the essential nutrients of the body. Although weight loss and fatigue may be associated with various factors, such as stress or metabolic problems, when they occur without apparent explanation, they should be investigated. These symptoms are an important warning that something may be wrong and should not be ignored. Therefore, if you notice significant weight loss for no apparent reason and feel a persistent and disproportionate fatigue to your daily routine, do not hesitate to seek medical advice to investigate these metabolic changes and ensure early diagnosis. Another important symptom to observe related to prostate cancer is the feeling of burning or pain when urinating, which may be an indication of prostate complications. When the prostate is increased, either for benign or malignant reasons, it can compress the urethra and make it difficult to pass the urine, resulting in discomfort during urination. This feeling of burning or pain should not be neglected, as it may be a precise sign that something is wrong in the urinary system. In addition, painful ejaculation is another symptom that requires special attention. Although often associated with prostate infections or inflammation, painful ejaculation can also be an early sign of prostate cancer. Pain during or after ejaculation can be felt as an uncomfortable pressure in the pelvic area or urethra, and sometimes radiates to the testicles or lumbar region. This symptom not only physically affects but also emotionally and can generate anxiety and impact sex. If you are facing this condition accompanied by other signs mentioned earlier, it is essential to seek immediate medical evaluation to identify possible prostate problems. In addition to noticeable physical symptoms, such as increased urinary frequency and incontinence, prostate cancer can also affect patients' emotional well-being. Men diagnosed with prostate cancer at advanced stages often experience a high level of anxiety, fear, and stress. Uncertainty about treatment, concerns about the future, and changes in the body due to the disease can significantly impact mental health. Many patients report difficulty dealing with intense emotions generated by diagnosis and symptoms of the disease. The emotional pressure resulting from advanced prostate cancer can lead to depression and social isolation, further impairing the quality of life of individuals. Therefore, it is essential that patients receive adequate psychological support to deal with not only physical aspects, but also with the emotional impacts of prostate cancer. If you have noticed any previously mentioned signs or symptoms and are concerned about the possibility of prostate cancer, do not hesitate to seek a doctor for a complete assessment. It is essential to remember that early detection significantly increases the chances of effective treatment and, consequently, a better quality of life. Acting proactively about your health is a crucial step in facing prostate cancer more assertively. Do not underestimate any sign that your body is sending, and remember that taking care of health is a priority. With the proper support of the medical team and the support of family and friends, it is possible to face this disease with courage and determination. If you have identified yourself with any of these symptoms or know someone who may be facing these challenges, do not hesitate to seek medical help. Your health is worth a lot. Espero que essas informações tenham sido úteis para você. Compartilhe este vídeo para conscientizar mais pessoas sobre a importância da prevenção do câncer de próstata. Take care.